There we go. Good evening again. So I'm gonna ask Rodrigo and then Pedro to introduce themselves because I don't know you guys. Do you know Alex and I?
No,
No?
no,
So do you guys mind introducing yourselves again? Because I know
No
you,
problem.
but
Sounds
Rodrigo and
good.
Pedro.
Yeah, no problem at
All
all.
right. Perfect. So let's get started. Rodrigo, Pedro, and then Alex and I. Deal?
okay.
Okay.
Um, my name is Rodrigo. I'm 44. I graduated in medicine 12 years ago, and I am a orthopedic surgeon about 7 years. I live at Resende, Rio de Janeiro. Uh, that's it.
Awesome. My husband is an orthopedic surgeon as well
Oh, in Brazil or United States?
in Brazil.
In
In
Brazil.
Brazil. In the United States, it's a long journey. It's a
Oh,
long
yeah.
orthopedics is. Do you plan on validating your diploma to work with orthopedics?
No,
No. Do you
no.
plan on staying here or moving to the US?
Moving to US, Texas.
Nice. What area do you like other than
Uh,
ortho?
General practice.
Okay, perfect. Nice, nice. And in
Maybe,
orthopedics,
maybe, maybe, maybe work with pain.
okay, good. Inside ortho, do you have a like a subspecialty?
No, I work with trauma.
Okay, awesome. Perfect. Awesome. All right, nice, nice. It takes a lot of courage. You, Alex, that I know have finished your residencies. Dai, have you finished? Have you gotten into residency in Brazil or not? I forgot.
No, no, I
Okay.
haven't.
It takes a lot of courage to get started in the whole process. And so congratulations to very, very, very nice, very noble, and I'm sure you guys are gonna get it. Nice, awesome. How about you, Pedro?
Oh, my name is Pedro. I'm 34 years old, and I'm an ophthalmologist. I graduated in 2016, and I live in Belo Horizonte, Minas.
Awesome. Do you plan on going to the US as well? Validating your diploma?
Yeah, I started studying for the steps since April, and then I planned to do another residence. But ophthalmology is very difficult to to have a match. So considering to do internal medicine, family medicine, don't know. I'm
Awesome.
going to Texas in October
Awesome.
with
Do you have
the
an observership?
no. I've never been to United States. The first
Oh,
time.
amazing, amazing. Yeah, it's as I told you, it takes a lot of courage to take this step, right? And it's a new thing, like changing your area and stuff. But I'm sure you're gonna fall in love with another area. Like medicine is huge, and we have many, many, many options. So you have to really balance out what you want to live, what you want your life to be like. And then I'm sure you're going to weigh out the benefits of moving and restarting. And the US is awesome. I'm sure it's going to be great. All right. Alex is also an ophthalmologist, right?
Yeah. I'm Alex. I'm also an ophthalmologist. I finished my fellowship in 2015, and I'm planning to start back in America as an internal medicine resident. Um, I always liked internal medicine. Like, my father is ophthalmologist, so I was pushed to doing what the family did and this kind of stuff. And I enjoy ophthalmology, but as you said, Pedro, it's a really big hill. I have a friend that's doing that, and like he did it, but it took like 8 years of research fellow, and I'm 39, so I don't have time for that. So I'm planning to start back and like applying for internal medicine, and maybe if I like in 3 or 4 years, once I do it, I can try a fellowship of something like this. But uh, for like starting, it would be like internal medicine too.
Awesome. Perfect.
Yeah, well, I was talking to Alexandre. Yeah,
Ah, we're talking in WhatsApp, yeah? Did we
yeah.
talk in WhatsApp? Yeah, so that's me. Yeah, we talked before. Okay.
Awesome. Are any of you guys interested in psychiatry? Because it's a
I
nice area and it's not that hard to get into it.
you know,
Like,
I really enjoy it. I did a post-graduation in Santa Casa, São Paulo. Yeah, I really enjoyed it. My first plan was to like work telemedicine in America, live in America and working like with Brazilian patients.
yeah.
And but like I was talking to I forgot the name of that guy that's in Texas. I think I forgot his name. It's the guy from the South, and he did residency in Texas.
Mhm.
And like, they told me like the doors are less wider than internal medicine. What do you think about it?
I think it's not too difficult. There's a Brazilian guy, I forgot his name. Médico América.
Yeah, yeah. I was talking to this guy, and like
Yes.
I
He's
imagine internal
quiet.
medicine would be easier.
Okay,
He has a mentorship.
Leonardo,
Leonardo.
Leonardo,
He
isso. That's it.
has a mentorship in Instagram.
yes. He is the only the only one that I've seen in psychiatry. So if you guys want to maybe
Yeah,
explore what he has to say, because I'm not sure.
yeah.
I'm
I also
asking about psychiatry because I'm in psychiatry residency.
Oh, that's not. I also talked to Vivian Sachs, the family medicine. She's a program director of family
Mm,
medicine, and she works for RD medicine, the Rafael Duarte one.
okay.
And she told me that like the more people are applying for psychiatry because like it's trendy and like no AI and all this stuff. So she was the one that told me like I think you should apply for internal medicine.
Okay.
Yeah,
Okay.
unfortunately. I prefer psychiatry. I think it's nicer, but whatever.
Yeah, I was just asking because I've seen him at some point commenting on psychiatry. And then I was like, maybe it's not that hard, but I'm really not sure. I'm not in this whole USMLE world. So,
Okay.
yeah. But nice. It's nice that you're interested. It's nice that you're interested. I love psychiatry, so it's not fair for me to say it.
Yeah,
But
no, it's really cool.
You
yeah.
are
But like,
not from US?
No,
Uh,
I am Brazilian, but I lived in the US for a couple of years during my teenage years. And then I moved back, went to college, and now I'm in psychiatry right here
wow.
in São Paulo. Yes. Hello, Natalia. Good evening. We're introducing ourselves, okay? So
Okay. Hello,
I
guys.
hello. I'm gonna
hello.
let you
Hi.
introduce yourself and then you, okay? Again. Go
Hello.
ahead.
Me?
Me?
First
No.
and then Natalia.
Okay. Go ahead. You
Dai?
first, Dai.
Eu? Ah, oh, okay. Sorry. My name is Daiane, and I graduated from medical school in 2019. And since then, I've been working and living in São Luís, Maranhão, Brazil. I've passed the step 1 exam, and I'm going to start my studies to step 2 when my observership finish. I want to apply to medical residence here next year. For to internal medicine, probably. It's my first time in United States. I arrived 2 weeks ago, and I'm on observership for 1 month at the Dr. Garcia's clinic.
Oh, that's good. So you're in Texas right now? You're in
Yeah,
Houston? Oh, that's great.
yeah.
Yeah.
It's been an amazing experience, a lot of knowledge, and I'm enjoying.
Nice. Do you feel
Congratulations.
comfortable? Do you feel comfortable like talking? Are you already like talking to patients, presenting cases and stuff?
And it's better now, but no, so good in the start at the start of the observership.
That's normal. You're gonna evolve in 1 month what would take you like a year.
Yes, I'm learning, enjoying our classes too.
Awesome. Amazing. Congrats, Dai. Congrats.
Thank you.
Is there anything that was like maybe an experience that you had that you really enjoyed?
Oh, Spanish. A lot of patients speak Spanish, so I'm learning Spanish too.
Awesome.
And English.
And was there like maybe a moment that really caught your attention? Something that you're like, I'm gonna bring this back, like a story, something that you would like to maybe share, something that happened, an
Mm,
interesting case.
about the Houston, United States.
During your observership.
Observership. Um, we're attending a lot of patients. Today we saw maybe 19 patients at afternoon, and
Mm,
we're speaking and talking to Dr. Garcia, saying about this, the history, clinical history, and physical exam, and the soap method,
mm.
using the soap method.
Awesome. Awesome. Next class, I'm gonna ask you again. And so be like open to experiences in the sense of um something that really marks
Okay.
story to tell.
Okay.
Okay?
Natalia is here with me.
Really? She's there too.
Yeah.
Yes.
Yeah, now your turn, and please tell us how is your experience as well.
Hi guys, I'm Natalia, and I'm here in Houston with Diana and Dr. Garcia. It is been an amazing experience. Everything's new, and it's very challenging also. And today is my second day here in United States. I arrived yesterday, and no, I arrived 2 days before, you know. And today I have my first patient, and then they speak Spanish. For me, it's difficult because I don't learn to speak in English, and to speak Spanish was very it's very challenging, but the things going it's going on, and I'm learning, and I can communicate it with other other keys, other enfim, is
Other,
that is main
maybe
thing.
other doctors? You can interact with other doctors and other people. Is that what you mean?
I mean, that's very challenging to speak Spanish
Mm.
and write in English at the same time. But it's working. It is working. I hope
Awesome.
so.
Of
You
course,
can
it's
you
gonna
can try the Portuñol with the patient.
Yes, I tried, and I use other, how can I say? I forgot the word. Other ferramentas.
tools, other tools.
Yes, other tools. Today I have to use gesso to
Mm.
communicate it with the patients. I wanted to know if the patient had difficult to go in flat to sleep, if she needed to put pillows in her back to sleep, but I didn't know how to say this in Spanish. And then I just, when you vai dormir, dormir. Okay, it's working. It's fine.
It's almost like sign language, right? You know, sign language,
Yes,
right? But sign language
it
is,
was humiliation, but it's humiliation the word.
but
But
it's
working.
curious. Even sign language has different languages. For example, English Sign Language is different from Brazilian Sign Language, from Portuguese Sign Language. It's, for me, it was like universal, but it's actually not. So even sign language is different. It's not universal. So, keep doing the hand gestures. And it's nice to see someone making an effort to communicate, and no one's judging you. No one's
And
judging.
the consult, at the end, the consult, the daughter of my patient's daughter told that I was amazing and very attention. They saw my difficult and that I really want to understand it to solve uh, her problem.
Exactly. So that's what counts. That's exactly what counts. You are making an effort, and everyone notices. Don't worry about that. Everyone will notice. They will know, and they will value your effort. So, congrats. And the same thing I told Dai, think about something that happened so you can tell us next class,
Okay.
like a story, okay?
Okay.
Maybe about a patient, maybe about something that happened, just like now, you just did it. So think about something else, just so we can discuss how everything's going.
Okay.
Okay?
Okay. Right.
Okay.
Amazing, guys. All right, so I'm gonna share my screen. I'm gonna give you guys the link. Please don't please don't um see the case, like the answer. You are going to know the case. You're going to see what it is. Don't worry. But I really enjoy having, the suspense so we can communicate. Okay. So let me just share the screen. And then first, I'm going to give you the link so that you can access. And one thing, an idea that I had, just so we don't spend so much time during class, I'm going to listen to you while we talk because I want us to talk a little bit more. Okay. And whenever you make a mistake, I will write it down, and at the end, I will send Dr. Garcia a voice message with the corrections. Okay? Just so we don't spend a lot of time correcting everything while we talk. And I don't want to interrupt you guys. Let's see how this works. Okay? So I'm basically writing everything down. And then I'm going to send you a voice. Which one do you prefer? Be honest. Do you prefer me to stop you or to write everything down and then send you a voice message at the end?
I prefer to stop me and answer.
Okay.
I don't know if the other guys prefer like that.
No, we can do this. We can do it like this. So let's maybe do it in chunks. Do you guys understand chunks? Como se fosse pedaços? Chunks. So I'm going to stop for like 2 minutes and tell you briefly the mistakes. Okay?
Mm-hmm.
So first, I'm going to share the other screen that I was taking notes on. So first, pós-graduação. It's nicer if you say like postgraduate course.
Okay.
Okay, Alex. So instead of saying post-graduation, you could say like postgraduate course. And we don't say graduate. Do you
Graduate.
guys remember what happened, what we talked about? Not last class. I think it was the class before last class. Second to last. Second to last é penúltimo, tá, gente? Second to last. Penúltimo. When I told you about ATE, lembram desse ATE? Not always it will have the eight sound. So post, let's say graduate as a verb will be graduate. It keeps correcting me. Graduate, right?
Graduate.
But because it's a course, and this is not a verb. It's a course that is a postgraduate course. So we don't say postgraduate course. We say postgraduate. Postgraduate.
Postgraduate course. Okay.
Exactly.
Postgraduate course.
Perfect. Dai, when you said 19, you said 19. Like 9 too strongly. This is not wrong. I'm just going to give you a tip. When you say this number, the 9 is really strong. And then the like 90. It's like 9, 90. It's even like a D sound. So that's why I'm writing it like this. 90. And then this one is 19. So the teen numbers, I want you guys to really emphasize the teen. And the 90 numbers, 80, like 80, 70, right? 60. Why am I being so emphatic with this? Sometimes we say like, for example, 15, 15, or 50, and then it gets people confused, okay? Did I tell you about my honeymoon when I went to my honeymoon? That I almost missed a flight.
Wow.
Almost missed a flight because of this. E uma observação, a gente não fala lost the flight. We always say for flight, para voo a gente fala missed, okay? So I almost missed a flight because I was in Punta Cana. and their Spanish, I mean, their English has a lot of accent. That's not a problem. But the way the guy said 50 got me confused with 15.
Oh,
So as soon as I arrived at the hotel, I was like, how far is the hotel from the airport? And he was like, 15 minutes. 15 minutes. And I was like, oh, 15 minutes. So
okay.
we left like really we got there, we got the flight, we took it, we took the flight, but it was by this much.
Wow.
So I thought he said 15. I literally like I lived those 7 days thinking I was gonna leave late to go to the airport. So it's just a tip. These numbers, the big numbers, the initial part of the number is stronger. The smaller numbers, the ending is stronger. So 15, 16, okay? It's just a tip. When the way you said it, I understood. But sometimes we talk fast and then it gets people confused. Um, Dai said we are attending a lot of patients. What's the mistake in this sentence? Just so I can see if you guys catch it.
Ending.
Attending.
Attending. Why is
Yeah.
it wrong to say attending?
The false cognate.
It's a false cognate. Do you have any idea what we could use instead?
Hmm.
See?
We attended.
No. Seeing.
No?
Who said seeing? I think Dai, right?
Mm.
Seeing is the best way. Posso chamar Nath? Nath?
Pode.
When you said, did you say we are attending also or another word? I didn't catch it.
I said we attended.
Oh, okay. That would just be a different formulation. You're just formulating it differently. But the mistake here was the false cognate,
Ah, okay.
as Pedro and Alex mentioned. It's a false, I always say a false friend. I say it's a false friend because it's used, obviously, and because a false friend looks like something, but isn't, right? Attending looks like atendendo, right? But it isn't. So seeing is the best verb for atendendo pacientes. For example, I saw a lot of patients today. I'm gonna see you right now. Vou te atender agora. I'm gonna see you today. It is a little bit weird because it's like see, I'm just gonna see you, but it's the verb that is used. Okay, so we are seeing a lot of patients. Nachi, when you said it's very challenged, were you saying challenging and I didn't hear you? Or did you say it's very challenge?
I said it's very challenging.
Okay. In this situation, we're going to use challenging. Okay?
Challenging. Okay.
Okay? Why? Challenge is the noun, desafio, right? Challenging is the adjective, desafiador. When we say é muito desafio, it doesn't really, it's not the correct way. But when we say it's very challenging, é muito desafiador. You could say it's a big challenge. It's a challenge, é um desafio. But challenging is the one we would use right now. Tools, ferramentas. We could just add this to our vocabulary list. Gestures, you could say hand gestures, sign language, linguagem dos sinais, right? This is just for you guys to remember. And I think Nachi also said they saw my difficult. right? They
Yes.
saw my difficult. It's a similar situation as this one. The correct way would be difficulty. Why? Difficult is the noun. Difícil. I mean, difficult is the adjective. Adjetivo, difícil. Difficulty is the noun. Dificuldade. You could say they saw it was difficult for me. It was difficult, but it was my difficulty. Okay?
Okay.
And one specific thing, you didn't make a mistake. I just wanted to talk about this. I'm just going to bring this up because I'm getting, it's too low and I can't, oh, maybe, wait. Let me just go like this. There. This, I wanted to introduce this idea because at some point you're going to use it. When we talk about a patient, this is indefinite, like an indefinite person. In Portuguese, we say o paciente isso, o paciente aquilo, and we say it in like the male form, right? Because this is how we say it in Portuguese. In English, we have a pronoun, which is they. It's an indefinite pronoun, okay? Não estamos falando de todes, okay? It's not the situation we have with todes. This is what happens in English forever. This is what has been happening forever. When we are talking about someone that we don't know, if it's a guy or a girl, we're going to use they. And we're going to conjugate it as exactly as we would with they. So for example, I'm telling you guys about this patient that I saw today, and I don't want to identify the patient as a guy, a girl, it doesn't matter. So guys, I saw a patient today and they were really sad. This patient is suffering from depression and they're really, really struggling. Do you see how I'm talking like they are, they said, they did, right? It's not more than one person. Okay, it's
Okay.
literally one person, but I'm talking about them. See, I'm talking about them as if, you know, I don't want you to know. It doesn't matter. It's not necessary. Just like when we talk about o paciente. Okay? Good. Now let's go back to the case. But do you guys prefer it like this? Like talking about the mistakes and then going back and forth?
Yes.
Sure.
I prefer because I don't forget the mistake.
Of course. But if you guys want to maybe change at some point, just let me know. Let me know. So today's case is about shortness of breath. Everybody say shortness. Shortness.
Sure.
Shortness.
Perfect.
Shortness.
Shortness.
Shortness of breath.
Oh,
So
breath.
of breath. Exactly. The title of today's case is She Gets Winded Just Walking to the Kitchen. So our goal is to approach dyspnea in the elderly. Everybody say dyspnea.
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 Dyspnea. Dyspnea.
Dyspnea.
Dyspnea. So I want you to really, really emphasize the dyspnea, right? This is the biggest trouble, the biggest problem we have with this word, dyspnea. Perfect. Can someone read this part for us?
A seven. Okay, you can do it.
Sorry, no.
You can do it. You can do it.
A 70-year-old woman comes to the ER with shortness of breath. She says it's been getting worse over the past few days. She denies chest pain, but mentions she's been sleeping almost upright.
Perfect. Everyone understands ER? Yes.
Emergency room?
Emergency room. Sometimes we see ED, emergency department, right? She says it's been getting worse, blah, blah, blah. She's sleeping almost upright. Does everyone understand upright?
She needs extra pillows to sleep.
Yes.
Perfect. She needs extra pillows. She's not lying down flat, right? She's not lying down flat. She needs extra pillows, as Dai just said. Let's try to remember our Socrates approach. Do you guys remember the Socrates approach?
No.
Syndrome. Trying to find a syndrome for her. That's what you're saying?
Actually, we want to ask her questions. We want to
Okay.
explore this symptom.
Oh, okay, I remember.
Pain
Yeah.
symptom. We use Socrates mostly for pain, but we can adapt. We can adapt this acronym for every symptom. So you can use Socrates, or you can just ask random questions. So let's just brainstorm. What would be some things we could ask her?
Okay, she said when it started, like for some days, few days, so it's not something acute, neither like very chronic, like some subacute, something like this, but I'd like to know how many days. Like the S of sight, there's like no use in this case. We
So
could
when,
ask her. Oh, okay, sorry.
go ahead.
Yeah, we could ask her if it get worse when she starts to do an exercise, if it's exertional, shortness of breath. I have to look for. She has a nocturnal paroxysmal dyspnea. Yeah, that's like the definition of what she has. I would ask in this case if she has any other symptoms. I'm thinking of heart failure in this case. So I'll look for edema, like pain, well, leg edema if she has like uh, other edema in like face edema in the morning or leg edema in the end of the day. She says that she doesn't have chest pain, so wouldn't think of acute coronary syndrome, but maybe uh, uh, heart failure, and I would like to look for the causes for that in her case.
Of course. We could have maybe an old AMI
Yeah,
at some or other risk factors. Maybe she's hypertensive. Awesome.
and maybe she's like having an engine, like an coeficiente anginoso. I'm sorry, I can't say that in English. Like
I
she
have
starts
no
heart
idea.
failing because of the uh, failure of perfusion in the heart muscle, something like this.
I have no idea how to say coeficiente anginoso. Maybe angina coefficient. Let me look this up. While I'm looking it up, do you guys have other questions?
If she take any drugs,
If she takes any drugs, or maybe has she taken any drugs to make it better?
yeah.
Relieving factors.
Relieving factors. Perfect. What is one relieving factor we can see in this text?
Sleeping upright.
Yes.
Yep, right. Exactly. Interesting. It says coeficiente anginoso não possui uma tradução direta para o inglês. Wow, I had no idea. Erase, let me erase this because I was just guessing, okay? It says you have to, in context where you want to quantify the risk associated to angina, you could use the HART score, TIMI score, or GRACE score. But that's interesting. I had no idea you didn't have a correspondent
Yeah. Wow.
term. Okay. But awesome, guys. Anything else? Can we fill in the blanks here just so we can remember the Socrates? The Socrates will be helpful. It will be helpful, I promise.
Character in the C.
So instead of character, let's change it to character.
Character. Oh, sorry.
Character.
Character.
Perfect.
Character.
Perfect. What is character?
How does this pain, like in the case of pain, feel? Like if it's pressure, like if it's throbbing pain, if it's
Sharp
Mhm.
pain.
Sorry, Pedro, can you repeat?
A sharp pain.
sharp pain, dull pains, stabbing pain, something like this.
The
Perfect.
intensity.
The intensity. What's the letter for intensity? It's similar. What are the three levels of pain? Leve, moderado, grave. In English, of course.
Mild,
Low.
moderado.
Hard.
Aliás, moderado is
Moderate,
moderate,
And
severe.
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 perfect. So mild. Instead of mild, we're gonna say mild.
Mild.
This one. Moderate. We don't say moderate, remember? Moderate is a verb, moderar. The judge will moderate the session. I don't know. Moderate is a verb. Moderate as an adjective is et. So mild, moderate, and
Moderate.
severe.
Severe.
So the letter, the corresponding letter, as Pedro just said, the intensity, severity. So how bad is it? Right? How bad is it? How about the R? What does it stand for?
Mild.
This R in the Socrates.
Radiation,
Radiation.
radiation, radiation.
Perfect. And the T? The T is tricky. Similar to on
Time, what?
time.
Or duration,
It's actually time course.
time course.
And it's like, how does it behave over time? It would be useful here for us. Like, do you wake up with shortness of breath? Does it get worse in the evening? Like, how does it behave over time? It would be kind of useful here. It's different from onset. Onset is like, when did it start? Right? For her, in this case, it's been getting worse over the past few days. But when did it start? Like a year ago, 2 years ago, right? So we have our Socrates here. I agree that we can't really say like where the shortness of breath is. It will be like here in general in your chest. But this is just for us to kind of remember everything. Always ask if it was sudden or gradual. On the onset, this is super, super important. There are some differentials for shortness of breath that being sudden or being gradual will be a key factor. Can we think of maybe a diagnosis that a sudden shortness of breath would be?
P, pulmonary
Pulmonary.
embolism. Oh, sorry.
Yes.
Match.
Yes. Pulmonary. Can we say this second word?
Embolism. Embolism.
Embolism.
Yes.
Embolism. Yeah. Embolism. Embolism.
Embolism. Good.
Embolism.
It's okay. We're gonna say it many, many times. We always forget. The ISM is tricky. Perfect. So pulmonary embolism or heart failure. Heart failure is gradual. So, right? Tightness, pressure, or just not enough air. Just a, kind of like a way to adapt the character. Because it could be maybe this is not too easy to kind of differentiate the character of a dyspnea or shortness of breath. But maybe like anxiety would be a little bit different from this type of shortness of breath. It could
Or
be,
asthma.
or
Asthma.
asthma, exactly. Because asthma is like not enough air and sometimes it might present with like a pressure, tightness and stuff. So, and history will help a lot, right? Um, Radiation. If the shortness of breath is too intense and it's causing pain, do you feel it radiating anywhere? Associated symptoms is something that you guys asked. We forgot about like respiratory infection signs, right? Because what is a condition that could cause shortness of breath in this case?
Pneumonia.
Yes, I love how you said pneumonia, Pedro. Pneumonia. We don't say the P. Pneumonia, right? So we need to think of pneumonia. Timing. So is it worse at any particular time of the day? Is it constant? Does it come and go? This is important. Exacerbating or relieving factors. Is it worse when you lie down, when you walk? In this case, yes. And then Alex just mentioned paroxysmal nocturnal dyspnea. Let's practice saying this term.
Paroxysm. Nocturnal dyspnea.
I love that you paroxysm. I love how you said this. But in this case, it's a longer word. But it's awesome. You got it. You got the trick with ISM, or in this case, YSM. But in this case, it's paroxysmal. So paroxysmal. And then we have
Nocturnal.
nocturnal. Perfect. And
Dyspnea.
dyspnea. Great. So paroxysmal nocturnal dyspnea. And severity. We could ask if it's a lot, like severe, moderate, or mild, Or on a scale of 1 to 10, how bad is it right now? These are just sample answers. So how the patient might answer. It started gradually over the past few days. It's worse today. It's not pain really. It's more like tightness or pressure. I just feel like I can't breathe deeply. Interesting word, breathe. Breathe, respirar. Breath, respiração. Right? Shortness of breath, como se fosse falta de respiração, que é a falta de ar. Breathe is the verb. I can't breathe. Ou seja, eu não consigo respirar. The verb, right? It's just in my chest, obviously. My legs have been a little bit swollen. No fever or cough. So here's an interesting thing for us to think of our differentials. It's worse at night. So it gets worse as the day goes by. This is interesting. It makes it worse when she lies flat. Sitting up helps. I get winded just walking a few steps. Winded is like, I get tired. I'm like, I'm winded. I get tired just walking a few steps. I brought this sentence also to the title of the case because it might be something the patient might say. I get winded just walking a few steps. And on a scale of 1 to 10, it's maybe a 7. It's scary sometimes. So these are just some sample answers. And this is for us to kind of grab some more information. This is just some natural language tip. So as I said, we can also say, she gets winded easily. She's having trouble catching her breath. I can't catch my breath. She said, I can't breathe deeply. You know, when you're like, and the air doesn't get there where it's supposed to get, it's like you can't catch your breath. This is a nice term for us to say. So she can't catch her breath. She has trouble catching her breath. And she can't lie flat. Lie flat é deitar, reto, right? There's another term that is interesting if we want to use. It's when you have trouble breathing lying down. We could say she has paroxysmal nocturnal dyspnea because she has this difficulty during the night, right? We're going to read, but she's using more pillows and stuff. But first, let's work on this word. Let's try first.
Orthopnea. Orthopnea.
Orthopnea.
Okay. More tries.
Orthopnea.
Orthopnea.
Good, Dai. Orthopnea. Orthopnea. Great job. This is a tricky word. It's a very tricky word. Great job. So orthopnea. Okay.
Orthopnea.
Yes, orthopnea. It's kind of like it has 2 stressed syllables, like orthopnea. You notice like the is kind of very open. Orthopnea. Orthopnea, right? Okay, can someone read this little bit for us?
She says she now uses 3 pillows to sleep. Walking across the room makes her stop and rest. She had some leg swelling and weight gain. No fever, cough, or chest pain.
Perfect. Nachi, great job with says. I just wanted to say it again because you kind of you stumbled. You were like, she says, and then you were like, correct.
Yes.
That was good. That was good. So we say it like this. We say she says instead of she says. Okay, so she says, she now uses. This is what I wanted to correct. So we're not going to say she use. We're going to say she uses.
Uses.
Yes.
Mhm.
They use, I use, right? But she, he uses. She uses 3 pillows. And she's had. She's had is an abbreviation to she has had. So we need to say the had. She has had. What is the verb conjugation in this case? I'm getting too grammarly, I know. But there's a point. It's present perfect. What is a very, very similar verb conjugation to present perfect? Translates the same for us. If I said, for example, she had, what is this?
Ela teve.
Exactly,
Past,
simple
past, yeah. Simple past.
simple past. When we translate, we say she has had. The translation is not ela tem tido. Never. Never, never, never. Okay? It could be ela tem tido if I said she has been having. That's another conversation. Ela tem tido, she has been having, or she's been having. In this case, present perfect, she has had, ela teve. She had, ela teve. It's the same translation. I'm just telling you this because sometimes when we see she has had, we translate ela tem tido. Okay? That's not the translation. The only difference is we use present perfect when we don't want to say when. It's like, for example, I've been to New York. Oh, I've been there. You know when someone's going through something and you're like, oh, I've been there. Tipo, eu já tive nessa situação. É como se fosse o nosso já. Isso já aconteceu. But you don't have to say when. But when you use simple past, you usually say when. It asks for the when. It's like she had leg swelling 2 weeks ago. Like you need to say when. For example, I went to New York. When did you go? Like it asks for when, okay? It's not an obligation in speech, but in written situations, it usually is like. And another difference is when you use present perfect, it's like you want to bring this to the present somehow. É como se fosse assim, ah, isso já aconteceu comigo. É uma sensação, okay? Like, for example, I have finished my homework. Eu terminei minha tarefa de casa. And I finished my homework is different because I have finished is like I just finished. Like it's right here right now. I want to bring this information to the present. That's why it's present perfect. Okay? So she's had, she has had. Como se fosse assim, ela teve isso e eu quero trazer isso para o presente. É como se fosse assim, ela teve e ela ainda tá. Okay? It's a feeling. That's what I wanted to tell you. Present perfect is a feeling. It's not a different translation because we don't have it. We don't have it in Portuguese. It's going to translate the same. Okay? I just don't want you thinking ela tem tido or something like that. Questions? I tried to make it very concise, but is it confusing? You guys are so silent. Is it confusing? Were you confused?
You explain very well, but it's difficult.
Okay. Vou falar em português. Isso é importante, gente. Eu sei que é chato, mas é um pouquinho importante. Vou falar em português para vocês entenderem melhor. Querem?
Claro.
Yes.
Ok.
Às vezes é uma coisa chata mesmo, né? A gente fica, ai, que saco. É porque, gente, realmente eu vejo tanto o pessoal falando, eu tenho feito, por exemplo, I have finished my homework. Eu vejo muito, se alguém fosse traduzir, eu não cheguei a fazer essa atividade, esse teste, né? Mas era capaz de alguém ler assim: eu tenho terminado minha tarefa. Eu tenho terminado. Só por causa desse have. E, na verdade, quando a gente coloca o have antes de um verbo que ele tá igualzinho no simple past, você adicionou o have, você transformou em present perfect. Só que a gente, em português, não tem essa estrutura. Então, fica esquisito pra gente. Porque na hora que traduz, fica estranho a gente traduzir eu terminei, sendo que tem um have aqui no meio. E ele traduz igualzinho como I finished my homework. Só que o problema é o simple past, certo? O problema nesse caso aqui, a sensação que passa, é isso que eu quero que vocês entendam. O present perfect é uma sensação. Então, a sensação é só a sensação, não é a tradução. A sensação que ele me passa é, por exemplo, cheguei em casa, eu tenho um filho, tal, eu falo, have you finished your homework? Yes, I finished my homework. I have finished my homework. Então, assim, eu já terminei. E é uma coisa muito que você está puxando para o presente. E você não precisa falar quando isso aconteceu. É como se ele não pedisse isso. Quando você fala, I have done it. I've done this before. É tipo, eu já fiz isso antes. Mas pode ficar solto no tempo. Isso aconteceu no passado, ele tem um pezinho no presente porque você já fez, então você hoje é uma pessoa que teve essa experiência. Você hoje é essa pessoa, você hoje é essa pessoa que terminou, agora você terminou, entendeu? Mas isso você está meio que trazendo isso para o presente. O simple past é uma coisa que ficou no passado. E acabou. Então, geralmente, muitas vezes em caso clínico, a gente vê muito mais o present perfect do que o simple past. Porque o simple past acabou. É como se fosse assim: she had leg swelling e agora ela não tem mais.
Entendi
Entendeu?
agora. Melhor.
É como se fosse uma coisa assim: aconteceu e ficou lá. Então,
Uhum.
geralmente, por isso que ele pede um tempo. Então, por exemplo, she had some leg swelling, tipo, 2 weeks ago. Você delimita isso no tempo, tipo, quando que ela teve? Porque ela teve e não tem mais, é como se fosse isso, entendeu? Então, essa é a flexibilidade desses dois tempos que vai traduzir igual pra gente. Mas como em inglês tem os dois, é bom a gente saber a aplicação, sabe? Por exemplo, quando a gente pergunta se alguém já foi em algum lugar, a gente nunca pergunta no simple past. Por exemplo, se eu quisesse perguntar assim, Pedro, você já foi em Nova York? Aí ele ia falar sim ou não, beleza. Se eu perguntasse, você já foi? Eu não perguntaria assim, por exemplo, Pedro, did you go to New York? Porque é como se fosse assim, você foi e eu preciso perguntar quando. É como assim, did you go last week? É como se essa estrutura nunca vai ser usada nessas situações, assim. Porque é como se fosse uma coisa que aconteceu e ficou lá, primeiramente. Então, não traz essa ideia, tipo assim, você já foi, ou alguma coisa assim. E também é como se fosse assim, é mais usado para, por exemplo, did you do what I asked? Você fez o que eu pedi? Did you do what I asked you to do? Agora, nesse caso aqui, eu perguntaria assim: Have you ever been to New York. Yes, I have been to New York. Então, I have been não é eu tenho estado, é eu já fui. Isso aqui é o present perfect. Eu já fui. Agora, did you go? Parece assim, tipo, when did you go? E ele falaria, tipo, eu fui 2 anos atrás. E ele meio que pede um tempo. Entenderam? Ficou mais claro?
Sim.
Okay.
Quando a gente vê mais vezes, a gente vai trazendo mais para revisar. Porque isso daqui é prática mesmo. Você vai vendo, você vai internalizando. Mas eu vou lembrando vocês nas próximas. Ok?
Ok.
Good, good, good. Perfect. So now let's go back to English. What are what are our top 3 differentials? I have some more, but I'd like to know as many as you can remember just so we can practice names of conditions and stuff.
Congestive heart failure.
Perfect. And while we're at it, can you repeat this last word, Nachi?
Failure.
Okay. Can someone else try to say it?
Failure.
I think your mic didn't, I didn't catch your mic correctly. Can you say it again?
Failure. Failure. Failure.
E?
Failure.
Failure. I don't know.
That was almost it. Alex, you were saying it also. You were like,
Failure, failure,
no,
failure. No.
almost.
Heart failure. Failure.
That was almost it. Okay,
Failure. Mm.
try it, Pedro.
Failure.
Failure. Good.
Failure,
Rodrigo,
failure.
you're so quiet. Do you want to try?
Failure.
Good. Guys, you basically made the same mistake. It's a common mistake. It's common for us to say failure. Failure, right? There are 2 ways. I'm going to go with the first one that is more similar to what you were saying. Failure.
Failure.
Failure. So we don't say failure. We say failure.
Failure. Failure.
Or failure.
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 Whatever is easier. Both ways are correct. It's just like angina and angina. Angina or angina. Both ways are correct, whatever you choose. Okay? So again, everyone, let's start with Rodrigo. How do we say it, Rodrigo?
What?
How do we say this word?
Failure.
Good. Perfect. Alex.
Failure.
Good. Pedro.
Failure. Failure.
Good. Failure. Perfect. Nachi.
Failure.
Good. And I.
Failure. Failure.
Failure. Perfect. Perfect, guys. So we have congestive heart failure. I confess I prefer failure. It's just, I don't know, I got used to saying it like this. So what else? We talked about some more. What were those? 2 more, I think.
Is
Can you repeat that?
kidney disease.
Kidney disease. That's a very important differential. We could have kidney failure also, right? Kidney failure. What are two others that we mentioned during class?
Like as the differential for orthopnea or for the case?
The whole case, the whole case.
Okay.
We mentioned two more.
Like pulmonary fibrosis with right ventricle heart failure, for example. She would have that, like the cor pulmonale because of a pulmonary disease, for example. She would have that.
Obesity hypoventilation syndrome.
Obesity.
Hypoventilation syndrome.
With pulmonary hypertension, yeah. Would work like
Perfect.
that.
Failure with hypoalbuminemia. Oh my God.
Can you repeat? Can you repeat?
Liver failure with hypoalbuminemia.
Hypoalbuminemia. It's a big word. Hypoalbuminemia. Okay. What else? We mentioned two more. The one with like infection signs and the one that was sudden.
Pneumonia.
Pleural effusion.
Pleural effusion. That's a nice one. Pleural effusion. What was the one with sudden shortness of breath?
Asthma.
Asthma as well. And the other one?
COPD.
COPD. But
Pulmonary
there's,
embolism.
yes,
Pulmonary embolism.
yes, yes. I even wrote ism. Okay, perfect. Pulmonary embolism. Is everyone familiar with pleural effusion? We didn't talk a lot about pleural effusion. Yes?
Pleural effusion.
And COPD?
Okay.
Yes? Perfect. Well, you basically mentioned all of them. Oh, one that we didn't mention, anemia. We didn't mention anemia. Anemia is a possibility, right? It's a simple diagnosis, but it could cause shortness of breath. It wouldn't have the edema, it wouldn't have the other signs and symptoms, but it's an elderly patient. The idea is to think of the most common things. Overload. Does everyone know this word? Overload? Yes. Sobrecarga. It's a nice diagnosis. I mean, a nice vocabulary word for us. Okay, so overload, sobrecarga.
And the anemia can be together with the renal failure.
Of course.
Yes.
Yes, with the renal failure. Of course. Because of there's a hormone that the kidney produces. If the kidney is failing, it's not going to be
Yeah.
produced. Do we remember the name? I'm
Uh,
forcing.
EPO,
I don't know how to say it.
That's the
erythropoietin,
challenge.
Erythropoietin.
erythropoietin,
Yes.
erythropoietin,
Erythropoietin.
erythrop.
Poietin. It's erythropoietin. I've seen erythropoietin at some, let's make sure, because I've seen the curiosity part of the class, because this is a hard one. Erythropoietin is more common, if I'm not mistaken.
And another hormone called erythropoietin, which
Poietin.
Generates a hormone called erythropoietin.
Poietin. I was wrong.
we have something called erythropoietin stimulating agents, which
This one, poietin, she said.
Erythropoietin,
Mm.
Isso é um site? Você pega isso no Google? Esse como pronunciar?
Yes. Guys, I think I showed this website.
I wasn't in the last class, so maybe it was that.
Yes,
I'm
you
sorry.
should.
Let me send it to you. Let me send
Okay,
it. It's
that's
called
good.
Youglish.
Youglish.
Youglish. What does it do? When you write the word, it will look for videos in which the word is being pronounced.
Oh,
So
that's
this
really good.
is way better than Google, for example. If, let's say, if I put erythropoietin, I was saying it wrong. Sorry, guys. That's why I looked for it, because I was not completely sure. Google also has it. So erythropoietin. See? Google has it, but sometimes it makes mistakes. So in this case, it's correct, but always make sure with Youglish, because sometimes it will be different. And then you have to go by what is more common. So what is more used, what is in real life, because sometimes Google will give you like a technical answer, but sometimes it's not what is used, you know?
Very good. Thank you.
This is a nice website, Youglish, youglish.com. If you type Youglish, you're gonna find it.
I already got it now. Thank you very much.
Got it?
I'm gonna
No
have to look for it.
problem. This is awesome, guys. This is like one of the most amazing pronunciation tools that we have. It's a very nice website. Anyways, so as Pedro just mentioned, renal failure can cause anemia. So, you know, we could have like two things associated. For our vital signs, I would like to keep the tradition of having one of you say it, because I want us to practice saying the vitals. So can someone say the vitals and then someone says the physical exam?
Blood pressure is 135/85. Heart rate is 92 BPM. Respiratory rate is 22 breaths per minute. And O2 saturation is 93% on room air. And temperature is 36.8 Celsius degrees. I don't know.
That's perfect. Degrees Celsius, you could say.
Degrees Celsius. Okay.
How did you say this symbol again?
Dot, but point.
Wait.
Sorry.
Perfect. When we say, if I wanted to tell you the website, I would say www.youglish.com. This is like for like websites and things like that. For numbers, we're gonna say point. So 3.8. There's another dot. I mean, dot is already there. Period. So on a text, blah, 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 period. Blah, 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 period. Blah, 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 period. This is a text, right? So in a text, or if you're having a discussion and you're like, I didn't like what you did, period. Tipo, ponto final. Okay, so period is like in a text, dot is on websites and things like that. point is for numbers. Okay, it's the same symbol, but different applications, right? Perfect, Dai, perfect. This word, I would like to make a small observation. Instead of respiratory, let's try to say respiratory.
Mhm.
Respiratory.
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 Yes. Perfect.
Respiratory.
Are the vitals good? Do you think they're good?
Only oxygen saturation
A little,
is little low.
little bit low. I agree. In general, would you say she's stable?
Yes, hemodynamically, it is a kind of stable.
Would you say she's well perfused?
Well perfused.
Yeah.
Capillary.
Maybe like looking at BP, heart rate. Would you guys say she's well perfused? Temperature. She does have some, respiratory alterations. Heart rate, respiratory rate is a little bit high. SATs are, a nice way to say SATs when we say them, when instead of O2 saturation, an easier way is SATs. You said it perfectly, okay, Dai? Just an easier way if you want to abbreviate, you could say SATs. So SATs are a little bit low, not too low, but would you say she's well perfused? Me too. I would. In heart failure, we have like a name we have for well perfused when we talk about profiles.
Warm and congested in her case, isn't it?
Congested is, of course, so warm for perfusion.
Yeah.
And congested, we have a word also.
Wet.
Wet.
Yeah.
Yes, wet.
Wet. So she's warm and wet. We're going to review the profiles at the end. But this is one of the most common profiles for descompensada. Heart failure, descompensada. How do we say this word in English? Very similar.
Compensated.
Can you repeat?
Uncompensated.
Almost.
Decompensate.
Decompensated.
Decompensated.
Okay.
Compensated. Perfect. So decompensated heart failure. One of the more common profiles is warm and wet. Perfect. Can someone read the physical exam?
Hey, Stephanie, I'm sorry, I'll have to go. Thank you for the
Oh, that's
class.
fine.
See
No
you next
problem.
week. Guys,
See
sorry,
you.
I'll have to go. Have a good
No
week for you guys.
problem.
Thank you
Bye.
very
All
much. It was great. Bye-bye.
right.
Thank you.
Bye. All right. Can someone read the physical exam?
Physical exam. On auscultation, the basilar crackles, S3 heart sound, mild pedal edema, and jugular venous distension.
Can you say this one again?
Mild
Yeah.
pedal
Mild.
edema.
Yes, and pedal was perfect. Pedal isn't one of the examples I think Google says wrongly. I think Google says pedal. And then when you go to Youglish, every video will say pedal. So, always make sure. And jugular. So instead of jugular, we're going to say ja, like jugular. Venus.
Jugular.
Jugular.
Venus.
And we don't say Venus, we say Venus.
Okay.
Okay? Just like with the word famous, we say famous. Famous. Jugular venous distension. And we say bibasilar. Bibasilar crackles. Bibasilar crackles. Okay. S3. Is everyone familiar with S3? Yes. In Portuguese, does it correspond to what?
B3.
Exactly. So in English, it's S. Why S? S stands for what?
Sounds.
Yes. Heart sounds. Just like in Portuguese, we have B for bulha. In English, we have the heart sounds. So heart sounds, S1, S2, S3. What do you make of the S3? Which means, what do you think is happening to cause the S3? This extra sound.
Dilation of the myocardium, the left ventricle, to be more correct.
Dilation. Maybe because
Delayed heart failure.
dilated. So the ventricle is more dilated, or maybe it's more stiff. Are you guys familiar with this term stiff?
Yes.
I don't know.
Rígido, endurecido. So it doesn't have a lot of, sometimes it will have too much elasticity and sometimes it will have too little. It doesn't matter. Either way, it will just make this extra sound because it's not filling correctly, right? Perfect. And how about the jugular venous distension? What does it suggest?
Right. Cardiac congestion.
Perfect. You could say, Pedro, right-sided heart failure or congestion. Right-sided is like do lado direito. So right-sided heart failure, right-sided congestion. Perfect. I have a brief explanation here just so we can kind of review. So the S3 is basically an extra sound. I brought this just so we can review also how we say it in English. So in Portuguese, we say tum tá, right? Tum tá. In English, we say lub dub. Lub dub, right? So lub is S1, and then dub is S2. In this case, tá is S3. Do we remember which valves will close in S1?
Mitral and tricuspid.
How about S2?
Aortic, and pulmonary.
And pulmonary. Do you guys know the trick to remember? There's a very nice trick.
S2 is a heart.
What?
S2 is like a heart.
It is. It's like a heart, but that's not the trick. It's a sentence. It's a sentence. Many things are possible. Many things are possible. So mitral and tricuspid, aortic, and pulmonary.
Mhm.
So S1 and S2. Many things are possible. So this is a very nice trick. I never forgot. So maybe if someone asks at some point, use many things are possible, and it's just nice. So S3 could be physiological. So when we have a very flexible left ventricle, it can be heard. So in children, young adults, pregnant women. But we have pathological S3. So it means that the heart is volume overloaded, como se fosse sobrecarregado com volume. Too much blood. So if it is, as we said, stiff or weak, one or the other, muito duro ou muito fraco, right? It can't handle the extra blood, and then you're going to listen to this extra vibration, this extra sound. Okay? Usually at the apex of the heart, apex, that's how we say ápice. Okay? So usually at the apex is where we're going to listen to this sound. Right? And some additional tests that we could ask for are the BNP, right? Because when the heart stretches, right, the levels of this peptide, because it's B-type natriuretic peptide, will elevate. Chest X-ray, we saw, I think Nachi said pleural effusion is very important. We can see pleural effusion. Pulmonary congestion, cardiomegaly. This is what we're going to see. We're going to look for the most in our hypothesis. Always we're going to order an EKG or ECG because we could be having ischemia, arrhythmias, or even left ventricular hypertrophy, which would explain heart failure. So this is nice as well. CBC, anemia, that could worsen the dyspnea or even signs of infection. Renal function, because we need to know about kidney failure and stuff. BUN, are we familiar with BUN?
Urea.
Yes. This is interesting because first time I saw this, I literally didn't understand why they called it blood urea nitrogen instead of just urea. And you're never going to see just urea. You're always going to see BUN, but it means urea. Okay? Simple. So creatinine and electrolytes. This word I would like to stop at. So creatinine, you could say it, creatinine or creatinine. Let's try.
Creatinine.
Perfect, Pedro. Very good.
Creatinine.
Creatinine. Good.
Creatinine.
Good. Perfect.
Creatinine.
Perfect. Guys, that's really good. Because we have creatine as well. So don't get confused. When you see creatinine, it's different from creatine. Okay? This is the one that we take for the gym and things like that, right? We need to know baseline kidney status, not just like to check for renal failure, but to see if we can start diuretics, right? What is the diuretic medication that we're going to probably start if kidney function is preserved?
Furosemide.
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 Let me help you guys. This is a hard one. So it's furosemide.
Furosemide.
Furosemide. Furosemide.
Good. Perfect.
Furosemide.
Furosemide. Perfect.
Rosamide.
Furosemide. Good. Perfect. That's perfect. So furosemide. Okay. So we need to check for baseline. Baseline is a word that you're going to see a lot, like baseline status. And then you're going to assess for cardiorenal syndrome because it's a possibility as well. And an echocardiogram to assess ejection fraction, wall motion abnormalities, and valvular disease because this is what we're going to look for in heart failure, right? Echocardiogram, we can just say echo in day-to-day life, okay? We don't have to say echocardiogram, okay? The next steps in management, we mentioned, Nachi just mentioned furosemide. Are there any other things you guys would like to do for management?
Fluid restriction.
Fluid restriction, I agree. I didn't even put fluid restriction, but I agree. It's something we could do.
Positive pressure respiration.
Perfect. Maybe give her oxygen.
Oxygen supplementation.
Yes.
Perfect. I know that's what you were thinking, Nachi. Yes. Perfect. That's basically it, right? There's not a lot of things initially, right? Oxygen, if needed, she's at a 93, so we could monitor her. Diuretics, furosemide, we need to monitor urine output and vitals because urine output will tell us if she's eliminating this fluid, right? If the diuretics are working. So we need to monitor if this urine is getting out, okay? Do we understand, does everyone understand this word, output?
Yes.
Yeah. Perfect. And also rule out causes of decompensation like diet, ischemia, arrhythmia. This is something we already did, but I wanted to kind of emphasize again because, you know, we could have other causes, okay? These are the differentials that we had in the beginning. This is just the reason why it's not the rest. So it's not COPD exacerbation because we have no wheezing, right? We have no wheezing, cough, smoking history, it's not mentioned. The exam favors fluid overload, no bronchospasm, right? When we auscultated, we didn't hear this. It's not pulmonary embolism because it's not sudden. We didn't have chest pain. No hemoptysis. The symptoms progressed gradually. Hemoptysis. Anemia would not explain the rest of the symptoms. Sorry, Nachi, were you saying hemoptysis?
Hemoptysis.
Yes. Hemoptysis.
Hemoptysis.
Do you guys want to try it as well? Hemoptysis?
Hemoptysis.
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 Perfect. So she didn't have hemoptysis, and the symptoms were gradual. Anemia would not explain the other symptoms. It could be associated, as Pedro mentioned, I think, could be with, right? But it wouldn't explain orthopnea, crackles, or leg swelling. She didn't have a fever, cough, localized findings on lung exam. Everything was bilateral, right? So, of course, we could have pneumonia bilaterally, but usually it's worse on one side. So, pneumonia, also, she didn't have fever, or cough, or anything like that. Renal failure is a possibility with fluid overload, but there's no history of kidney disease or uremic signs, right? And also, we have a lot of heart findings, S3, jugular venous distension. So it's kind of like what is more right in this case. This is just kind of like a summary of the case. Usually, we have more time to kind of have each of you summarize, but today I'm gonna do it like this. We have 4 people. Can we get 1, 2, 3, 4? I'm gonna ask, well, I'm gonna ask you to go like in line. Each one says 1 sentence. Can we do it like that? So
Yes.
I'm gonna start, I'm gonna have Dai. This is the order I have here. So Dai, Rodrigo, Pedro, and Nachi, and then it goes back. Can we do it like that?
Yes.
So Dai, can you start?
This is a 70-year-old female with progressive dyspnea over several days. Several days.
Several.
Several. Sorry.
He reports orthopnea, PNZ, and leg swelling.
Rodrigo, can you say this one again, but emphasizing this syllable?
Orthopnea.
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 Remember orthopy. You are orthopy.
Orthopnea.
Yes. Perfect. Perfect. Pedro?
On exam, she has JVD, bibasilar crackles, pedal edema, and S3.
Perfect. 1 second. Let me just explain to you guys. Maybe Pedro was like, maybe end NS3 is wrong because it's like end N. But we say NS3 because S, when we say S, it's kind of like this, right? S. Vou falar isso em português, que é um pouco confuso mesmo. A gente aprende sempre. Prometo que não vou me alongar muito, gente. Eu sei que tá tarde. Mas a gente aprende sempre que quando a gente tem uma consoante depois, a gente usa an, a gente usa a. E quando é vogal, an. Então, tipo, a house. An arm. Certo? A gente aprende isso, né? Que quando é consoante, depois a gente vai usar o a. Quando é vogal, a gente usa an. E aí, esse NS3 fica estranho porque não faz sentido nenhum, né? Se aqui é consoante, por que que seria And. Que aqui seria, por exemplo, I1S3, digamos assim. Mas o som do S, embora seja uma consoante, quando você fala a letra S, ele soa como E no começo. Então, é como se fosse um som de vogal. É a mesma coisa que quando a gente passa um caso de um paciente de 1 ano de idade. Quando eu falo um paciente de 1 ano, eu vou falar a 1-year-old patient. E não an 1-year-old patient. Por quê? A, one. One, o som que ele tem é de W. One, wa, sabe? Então, por isso que eu falo a 1-year-old e não an 1-year-old. Mesma coisa com a university. A university é porque university tem um som university. Tem um som de U. Esse U, ele tem som de university. Sabe? Então, é por isso, tá bom? Não é que o que a gente aprendeu antes está errado, é que não está completo. Precisa da gente lembrar que não é só a letra, e sim o som que a letra emite. Se a letra emite um som de consoante, tipo one, university, a gente vai usar a e não an. Ok?
Uhum.
Assim como, por exemplo, quando a gente fala de uma letra. Se fosse um M3, eu ia falar an M3. Porque M é a mesma coisa que S, sabe? Ele tem o som de E no começo. Ok? Entenderam ou ficou confuso?
Sim.
Entendi.
Sim.
Entendi.
Good. Nath,
Her vitals are stable with set at 93 on room air.
perfect. Can we say vitals again?
Vitals. Vitals.
Vitals. Dai,
Chest X-ray shows pulmonary congestion and cardiomegaly.
great job. And Rodrigo,
She fits a warm and wet profile and was started on IV direct.
perfect. Do you see how this is summarized? So when we're presenting the case, this is all we need. It's the main things. The chief complaint, what she, the HPI, the history of presenting illness or presenting complaint in some cases. Physical exam, extra tests, right? In this case, chest x-ray. And then the conclusion, your assessment. This is the SOAP method that Dai was mentioning that they're doing a lot. Subjective, her symptoms, right? Objective, physical exam and her tests. Assessment, she fits a warm and wet profile for heart failure, right? And P is our plan. She was started on IV diuretics mainly. This was the main thing that we did, the main aspect that we worked on for management, right? Guys, do you have questions?
No.
Would you like to go back to anything?
Oh.
As usual, I left you a little bit of a reminder for warm and wet patients. And a summary of how we could discuss about this. We kind of went over all of this, but this is just like a summary for us. Okay?
Mhm.
Okay.
Would you like to take a picture? To
Yes.
show live. We are alive until now. I'm sad that Alex won't be in the picture, but let's have our picture. Let's smile.
Say hi.
Mm.
Let's pretend we're happy at 11 p.m. Guys, thank you so much for today's class. It was great as always. If you have any questions, I think Nachi and I have my number. You can share in the group. Okay.
Yeah.
If you need anything, I'm here. Okay. And have a great rest of the week. Have a great Friday.
Thank you.
Thank you.
Thank you so
See
much.
you guys.
You guys, so
Good night.
Have a
Good
good night. Thank you, teacher. Bye.
Bye bye.
Bye bye. Bye, everyone.